Good morning, everyone. Welcome to the 13th in our series of system-wide WSU COVID-19 town hall meetings. Glad you're all able to join us. My name is Phil Weiler. I'm Vice President for Marketing and Communications. And once again, I'm going to be serving as the moderator for our session this morning. It's worth noting that this is actually the first of what will be two different COVID-19 town halls today. This session is geared toward students and employees as well as members of the general public. We have another town hall scheduled for tonight at 5 p.m. that will be specifically aimed at students and their family members and caregivers. So I'll talk a little bit more about that in a moment, but let's talk about what we'll be discussing this morning. Our town hall this morning is going to cover a variety of topics. We're going to start off with a discussion about what our plans for the spring semester classes will look like. We'll talk in some detail about our COVID-19 testing plan for COVID-19 in the spring semester. Talk a little bit about plans for housing on the Pullman campus. We'll get a quick update on student services and activities fees. It's been an area or a topic of interest ever since we made the decision to go from face-to-face to virtual back in March. So have some information to report based on action by our Board of Regents just last week. We'll touch briefly on some research that WSU faculty members are doing that specifically looks at COVID-19 and what we might be able to do to help combat the pandemic. And then finally, we'll close with an update on what infection rates look like here on the Pullman campus. As most people are aware, we did see an outbreak early in August at the start of the semester, and so it's worth us getting an update on where things stand today. So again, as I mentioned, we have a second town hall scheduled for tonight at 5 p.m. Again, it's going to be aimed at students and their families, and it's going to go into greater depth into what the spring semester will look like. So if that's something that you're interested in, you can go to experience.wsu.edu and to be able to access that session as well. And that's scheduled to run an hour. So our panelists today, let me introduce them briefly. We're joined by Kirk Schultz, president of Washington State University. Elizabeth Chilton, she's our provost and executive vice president. Colleen Kerr, vice president for external affairs and government relations. Mary Jo Gonzalez, vice president for student affairs. Dr. Jessica Bell, she's a clinical instructor in our College of Veterinary Medicine. Dr. Raylyn Farnsworth is a clinical associate professor in the College of Veterinary Medicine. Dr. Anthony Nicola, who's an Engel Distinguished Professor of Infectious Diseases, again in the College of Veterinary Medicine. And then finally, Jason Sampson, and Jason is the Assistant Director of Environmental Services, Public Health, and Sustainability. So with the introductions out of the way, let me turn it over to President Schultz and he can kick us off.
Well, hello, Cougs, and welcome to lucky number 13 today. Thanks for joining us, and I hope you find this useful as always. And we have a bunch of questions that were submitted in advance that all of us have seen, and we'll certainly try and get to as many of those as we possibly can. Just a couple things as we get started, though. I don't know about you all, but I'm certainly reached the point in the semester where kind of weariness takes over. I find myself by 5 o'clock just kind of exhausted, all the Zoom calls, the interactions that we do in this particular way. And during a regular semester, during Thanksgiving time is a time when many of us get a little bit of a chance to recover a little bit, work a couple days, have some time with family. And then with the end of the semester coming up just in a few short weeks, we'll have some time, hopefully, for everybody to get refreshed. But to our faculty, staff, and students out there, I just want to remind you, occasionally shut the laptop, take the evening, go watch Netflix, read a favorite book, go for a walk, do whatever you need to, but make sure that you're taking care of yourselves and you're giving yourselves those time to recover from this kind of constant looking at a video screen. As the holidays come up, though, please, we're going to ask all of you to take precautions to protect those around you, your loved ones, family members, friends, colleagues. 3 simple things, and we'll remind you of these again and again. First, wear a mask. Second, wash your hands. Third, watch your distance. These are not any different than we've been communicating all along, but we want to remind everybody that it's really, really important. This applies to our entire university community, not just our students, but our faculty and staff as well. And we've seen some recent spikes in COVID cases in our community. And a lot of that has been attributed to social events and after work activities and things like this. And not just in the 18 to 25-year-old age group. We're seeing this in a lot of our faculty and staff. So just a reminder with the holidays, please continue to be careful. We also encourage all of you to limit your travel this holiday season if at all possible. And students, we'll repeat this multiple times. If you are traveling home, please get tested before you go. Once you leave campus for Thanksgiving break, we're asking you not to return until the spring semester starts in January. This is going to be really important. Yesterday, I'm so proud of our folks here at WSU did 500 COVID tests, the most I think we've ever done in a single day. So I know many of you are doing this, but it's going to be really important moving ahead. A reminder to all of our employees, please continue to work remotely whenever possible. If you do have to come into work, remember to attest every day, but we want to make sure that that's clear as we want people to continue to work remotely from home or from those out of office spaces as much as possible. If you test positive for COVID-19, please remember to provide the contact tracers with a complete list of your contacts and where you've been. This is really, really important because this allows us to go and understand the spread of the virus through the community or coworkers or things like this. And being as upfront as possible is really important. We're not trying to do a judgment call. We're trying to get good information. And I know Jason and others may talk about this a little bit more. I get tested once a week. Every Monday, I've just made a commitment to go in and get tested and then just to really make sure that I limit the folks that I interact with on a personal basis. Finally, I love the holiday season. I love being around family members and things and sort of celebrating the year, as it will. But we're going to remind everybody on campus, those holiday celebrations need to be done virtually. We don't want to have any type of event for faculty, staff, or students on campus. So while it's going to seem a little strange, make sure you get creative, use Zoom and other types of things. But we're going to remind everybody, no in-person holiday gatherings on campus for any particular purpose. Avoiding those group gatherings is a key step, really, in slowing the virus in our community. Finally, I am super proud of all the folks that you're going to hear from today on this particular video call. We got some exceptional faculty doing great work around COVID-19. We've got staff members and other vice presidents and other key individuals that have been working all semester at not controlling the virus, because nobody's going to control it, but certainly making sure that we're keeping our community safe. We're keeping faculty, staff, and students as safe as possible, and that we're learning from our mistakes or things that we could have done better. And I think as you hear about our spring testing plan, we want to take the things we learned in the fall and we want to apply those to the spring term. So I'm proud of the job that all of you are doing. I'm proud of our faculty, staff, and students. I'm proud of your resilience. Keep at it. And as always, thank you for the opportunity to serve as your president, and go Cougs.
Great. Thank you, Kirk. You made the comment that if students do choose to travel home for Thanksgiving, that they need to make sure they stay home until the start of the semester. And it's probably worth reminding students that means you're going to be gone for 2 months. And so you need to make sure you've packed the winter clothes you need. You need to make sure that you have all your textbooks, that you have your phone charger, and you need to make sure you clean out your refrigerator, because you're not going to be opening that door for another 2 months. And as a student who didn't think about that when I was in college, and coming back and opening that refrigerator door, it becomes a very nasty science experiment. So do make sure that the fridge is properly cleaned before you leave for a couple months. With that, let me turn it over to Provost Chilton. Elizabeth, I know we talked a little bit at our last session about what spring semester looks like, but we still get questions. And in fact, even some of the questions just this week that came in, it's clear that we need to continue to talk about with folks what the plans look like for spring. So could you share a little bit about that?
Yeah, sure. If you don't mind, I will just tack on though to what you were just saying about travel for Thanksgiving, just to say that, most of our classes this semester are remote on all of our physical campuses across the system. But even those, we have about 30 classes on the Pullman campus, for example, that do have some face-to-face component. But after Thanksgiving, we have asked, even those with physical components to the class, that we've asked faculty to be accommodating for students who stay home. There might be a few exceptions, some of our clinical or health science related or internships or what have you. But please check with your professor. We've asked them all to be flexible and allow students to remain home after Thanksgiving if they choose to travel. But for spring, we've learned from this fall that a lot of what we're doing to keep our students and our staff and our faculty safe, that it's working. Those face-to-face instructional activities, we're requiring PPE, they're maintaining social distancing, they're doing training, and we've seen that really works. And so we expanded that model for the spring. We still are going to be offering instruction primarily remotely, but we've expanded the number of in-person activities or classes to about 65 or so. And these include things like art studios, working with animals in our agricultural sciences, engineering if they're using really specific equipment that would just be impossible to replicate. We made those exceptions for each campus. The exceptions for Pullman came through my office, but each of the other physical campuses made their own exception process to make sure we were maintaining the highest educational quality, but also keeping people safe. Also, Phil, that we decided not to have a week-long spring break for spring, but instead we will take 5 days that will really be no class, no assignments, no Zoom. We have to come up with a catchy phrase like, I don't know, they're just like no Zoom days or something where, students and faculty, quite honestly, can just take a break from computers, and our faculty can be doing other kinds of things, but our students can really just take a true break at periodic times throughout the semester. So that's what we're looking at. We're also going to be starting about 8 days later than we normally would. In part to give everyone a nice long break and to allow for potential staggered move-in. And I know Vice Wallace will talk about that in a little bit.
I'd like now, if we could, to turn to Colleen Kerr and have Colleen talk about the COVID-19 testing plan that we have been working on. Colleen, I know that there's been a large number of people who have been working for quite a long time to put together this plan. And I think we've talked about this in previous town halls. We did have a different type of plan in place that we were developing over the summer when we thought that classes in the fall would be face-to-face. When we made that decision to not have face-to-face classes, that surveillance testing plan was no longer relevant. But we do have a different approach that we're looking for in the spring. So I'd love to have you talk about that. And my understanding is there are sort of 4 major components to that plan. So could you walk us through those?
Yeah, sure. Thanks, Bill. So let me first thank you and Mary Jo and Jason, who have all been working really closely with Daryl and me, Dr. DeWald, on testing, attestation, and contact tracing. So our goal for spring semester will be to test every student who comes to Whitman County. That is without question our goal. And so as we work toward that, we have put together a testing plan that has 4 components. And so let me talk about those just for a moment here. So the first is arrival testing, and this is a really important component of this. So students, as you are coming back to Whitman County, we are going to be offering and inviting and asking some of you to participate in arrival testing. So there are a variety of categories of students who will be participating in this. The first category is any student who's living at WSU. So if you are living in a hall of residence or you're living in an apartment, we are going to have a program set up for you to participate in arrival testing. We are also going to be asking our student employees, those students who are participating in either Pac-12 athletic programs, intramural sports, or sports clubs, to participate. If you're going to be using a WSU facility like the Rec Center, the Chinook, we're going to ask you to participate as well. And so we will be clearly stating that. We'll be working with maybe Army National Guard again, or with other partners through Insight to offer a robust arrival testing program so that before you actually move into your location or before you interface with WSU facilities, that you will be participating in arrival testing. If you don't fall into that category, we will also have testing for you. And so we would invite any of you who are coming into Whitman County to participate in arrival testing on a voluntary basis. And we will have that set up in January, well in advance of classes starting. In addition, we will have other components of a testing plan. So the other one is diagnostic testing. So Cougar Health Services is going to be focused this semester exclusively on diagnostic testing. And so that means if you have any symptoms of COVID-19 per the CDC or the State Department of Health, or if you've been a close contact, which is happening because of the disease spread in Washington State, then Cougar Health Services is appropriate for you. And so really students can avail themselves of a number of different options, but diagnostic testing will be a significant component. And for that one, you'll want to bring your insurance card if you have one. And if you don't, that does not matter. Testing is available to you. So the other two components are voluntary screening testing and then targeted screening testing. So voluntary screening testing is going to be exactly what we are doing in fall semester right now, and many of us are aware of that. So for students, for faculty, for staff, if you hold a Cougar card, we will have voluntary screening testing. So that is, you don't feel like you need to go see your health provider. We're going to have testing available for you, exactly what Kirk is participating in. So he goes once a week. We will have that opportunity available to you. We have an extraordinary team of scientists. We have some faculty here today. We have an extraordinary team of scientists led by Dr. Guy Palmer, who is a senior director for global health. He is the founder of the Allen School for Global Health. He has been working with a group of modelers. And so once you participate in voluntary screening testing, we may very well ask you to continue to participate. And so you would receive communications from us asking you to participate anywhere between 2 and 4 and maybe more times a semester, so that we can really have a good understanding of what the disease looks like in Whitman County. In addition, we're going to be doing targeted screening testing. And so there's a couple of different categories for this. The big one is wastewater sampling. So wastewater sampling is that any facility that WSU has domain over, so that's WSU building. Jason and his team have been working with a number of folks to actually sample the wastewater. And if we see the wastewater sample turn from negative to positive, then we will be asking the people associated with that building to participate in screening testing. It is a really important way for us to be able to quickly identify those individuals who may have COVID-19 and then to isolate them from the rest of the community. And then the second component of targeted screening testing would be for those students and faculty who are participating in certain programs. So athletics is one that we are familiar with. We would also identify, for example, some student employees and also some students and faculty participating in certain research programs. The Office of Research has been a leader in addressing safety protocols during COVID-19. And in the process of looking at some of the labs that we have and the working environments, it is their opinion that based on inability to maintain physical distancing and the type of research that's happening, that for students and faculty participating, the Office of Research will require a targeted screening testing program. Similar to the voluntary screening testing program, the frequency of the testing would be determined by our faculty and led by Dr. Guy Palmer.
Thanks, Colleen. Couple things come to mind for me based on what you just said. I mean, one is, so just so I'm got it clear in my head, the 4 components are, we're going to be doing arrival testing on the Pullman campus. We will do diagnostic testing for anyone who has any kind of a symptom. We'll do voluntary testing, and then there'll also be, as you mentioned, that targeted testing where we would use things like testing of effluent wastewater to be able to see if there is a presence of the virus in there, and then we could test those particular buildings.
Yeah.
Can you talk a little bit about, first of all, why is this testing in Pullman, and are there testing opportunities at other campuses as well?
Yes, that is a great question. Thank you. So I failed to say that our testing plan right now that that we have had approved by the Board of Regents and that we are working to operationalize is actually for the Pullman campus and the Spokane campus. We will have arrival testing for our Spokane students and for faculty. We will also have ongoing voluntary screening for our Spokane campus. The reason that we have moved forward with those two campuses first is because of the nature of the campuses. In Spokane, for example, because we have a clinical student population that, because they're in a clinical environment, have the potential for a higher risk of disease spread. Similarly for our faculty, it's critically important we provide this for our faculty and students. In Whitman County, we are truly unique, correct usage of the word, in the state of Washington. We have a large residential student population, a little smaller during COVID, granted, but it is still a large residential student population in a county that has limited access to healthcare. If we think about the reasons that we decided to move forward with pursuing a medical school, it is exactly for reasons like this. There are many counties in the state of Washington that have limited access to healthcare. Whitman County is one of those counties. And so because of the nature of that, it is really important that we move forward with a testing plan. For our other campuses, the majority of the counties in the state of Washington do offer screening testing. Because we don't have formal residential facilities on those campuses in Everett or in Clark County. I know we do have housing, we have affiliated housing in the Tri-Cities. We are not moving forward at this time with screening testing. Having said that, I really want to acknowledge Chancellor Haynes and our Tri-Cities campus for moving forward in terms of partnering with Benton and Franklin counties to offer screening testing on our campus for our faculty there. And those are options that we will continue to work toward and to explore with local public health all around the state for all of our WSU locations.
And my understanding is that there will be testing available on the WSU Everett campus, that we will be partnering with healthcare providers there, and we will provide the location for that testing to take place.
Yeah, so one thing I want to remind all of us, and we can provide a link, the Department of Health has information for local public health in every county, is that, again, in the majority of the counties in the state of Washington, local public health has partnered with healthcare providers and with the state of Washington, sometimes through FEMA, to offer screening testing. And we can participate in that. And so again, that is the model that the Tri-Cities and Everett, that's the model that they are working toward.
Yeah, and I think that is an important point to make, that part of the reason that we are focusing here in Whitman County, where the Pullman campus is located, is because currently Whitman County does not have a screening testing option available for the members of the community. I'm going to ask the folks who are monitoring our chat here in YouTube to please pull the link for our testing plan and put it in the chat function. As we have done in all of our other town halls, we do have subject matter experts who are monitoring that chat in YouTube and trying to answer questions people have. And I think that the chat might be a good place if someone wants to learn more and get a little bit more detail about what that spring testing plan looks like. It is available on our COVID-19 website. And so it'd be good for folks to be able to look at that when they have a moment. So Colleen, thank you. I appreciate you, all the work that you've done around this. It has been a large effort involving a lot of senior faculty who are really experts in this area of infectious disease and disease modeling. And so thank you for helping bring this to fruition. And I'm looking forward to being able to get this plan kicked off and hopefully really have a significant impact on suppressing the virus moving forward. So thank you. Mary Jo, I'd like to have you spend a few minutes, if you could, on two different topics. As I mentioned, we are looking at making a change for spring semester around housing, that we might have a few more students on campus. Have you talked about that? And then also talk about, if you could, the services and activities fee. As I mentioned, that was something that's been of concern for students for quite a long time. And talk a little bit, if you could, also about how those services and activities fees are set, who makes the decision for how that money is spent. I think it's a great opportunity for people to learn a little bit more about those fees.
Absolutely, Phil, and I'm really excited to join all of you. It's been a while, but I also know that you've had some amazing people here on the town halls, and I'm glad to join you today. I do want to remind you all that we are having a dedicated town hall for students and their loved ones this evening at 5 o'clock. So I'm going to give a very surface view of these two topics, but we will go much more in depth this evening. And I actually have some really amazing colleagues who will be joining us to talk about this. So please join us on that call. And before I answer the questions, I do want to say something to all of my Cougs out there. I know you're tired of the Rona. I know that I've heard from many of you that it's really hard right now. Some of you are full on in Zoom and COVID fatigue. And I know you're on your last nerve. You've told me how lonely you are, that you're hurting and that you're scared. And you're really disappointed that your plans for break wouldn't be what they wanted to be. I think it's really important for you to know that you are not alone and that we're here for you. Ask that you reach out and get help, that you don't try to do this on your own, that you call a friend, don't Zoom, call a friend, don't text, call and talk to a loved one, call us, talk about what's happening and what is working and what is not working for you, because we're here. And if you're doing well, if you're one of those Cougs who's like, I'm so excited about what's happening, the semester's gone well, please reach out to your friends, please connect with one another, because right now, more than anything, we need to be supporting each other and taking care of each other. And I think it's also important that in our Cougar country and our Cougar family, that you're going to be hearing from some faculty who are doing some really amazing things around COVID-19. And people often say, Mary Jo, how is that connected? Well, I will tell you that they are all fighting for Washington State and fighting for you as Cougs as well. So the research that they're doing is making a tremendous difference. And frankly, that research is allowing us to bring more students back to campus. So we're going to all win the day for Crimson and Gray by serving in the roles that we have to serve in. So please remember that we're supporting each other, and by supporting each other, we're able to do and overcome and frankly cancel COVID like we're all hoping to do. So part of what we've heard about the mental health issues and the issues that our students are facing around academic performance is that they really want to be on campus. And we wouldn't be able to do this without Colleen and Daryl and so many others fighting, as well as our faculty members who are modeling what the COVID transmission rates would be on our Pullman campus. So we are excited to welcome back our first year students. We do have rooms available. There will be single occupancy. There will not be double occupancy. All of the data tells us that this is the best strategy for our students. And so we are really excited to welcome them back. All first year students received an email from us to go and sign up for housing. And so that will be open all the way up until the first day of classes. So if you find right now you're not ready to make a decision about that, or if you know someone who still wants to think about that, it will be available through the first day of classes. Please go to housing.wsu.edu. And again, that's housing.wsu.edu for all of your questions and answers. I will also want to remind you to get tested, because getting tested allows us to find out what's happening in our Cougar community. And Phil, about the student fees, I have the pleasure of working with students about 11 different advisory groups who coordinate the student fee process for us. And what often happens with student fees is the students decide for themselves that they want to do a referendum and get approval for that particular fee. That's everything from the Evergreen fee that we currently support. It's $5. It helps the Daily Evergreen get published. It helps those aspiring journalists to do some really amazing work and stories. It allows students to, again, invest in their university experience. And so students asked us early in the fall to reconsider that. The president and I, as well as our senior leadership team, thought that it was the most important piece of that would be to frankly include students in the decision. And so all of our boards on the Pullman campus met. Our Student Health Advisory Committee, the Chinook Committee, our Cub Advisory, Student Senate was involved, and they made some decisions. It will be about a $75 return to the Pullman campus. And those boards included about 250 students, frankly, from across the system who participated. What will happen for students is if the fall fee was something that the recommended board said, and that would be, for example, the SRC fee and the Chinook fee, they will post this fall, and they will post in December, and they will show up as credits for the spring. If the board's recommended that it's a spring delay in fee, and that's something like the Student Health Advisory Committee, which recommended not collecting $40 of the spring fee, that will also show up. So those will show up as credits in the spring where students will not have to pay those, and it will help pay for their spring process. We do have, Phil, a normal process that goes through the spring that we're working on for all of those fees, and we do have some boards who are still looking at those fees, but I definitely wanted to give you a very brief update where we're at.
Great, thank you, Mary Jo. I think the point you made is worth repeating. Students, in essence, vote to tax themselves to support programs that they think are of value to them, and so I think it makes perfect sense that those student bodies, those student boards, get an opportunity to make a decision about what fees need to continue and which ones should be waived. And so, as you mentioned, there were quite a few meetings on the Pullman campus. I know there were meetings on Tri-Cities campus, I believe, as well, because they also have their own services and activities fees. So thank you for that update. I appreciate that. I'd like to change gears a little bit now. And as Mary Jo mentioned, Washington State University is fortunate to have a number of nationally recognized experts who are doing work on COVID-19, and specifically how we as a human population can get ahead of this particular virus and make sure that it is not causing us to have to continue to be locked down and to take steps that none of us wants to take. And I'm going to turn the mic over to Drs. Jessica Bell and Raylyn Farnsworth here in just a moment, but it's worth giving a little bit of an introduction to the work that they're doing. As I mentioned earlier, they are part of the College of Veterinary Medicine. Our College of Veterinary Medicine has been for many, many years working on a type of diseases called zoonotic diseases. These are pathogens that typically will jump from animals to humans and infect people. And so College of Vet Med has been really focused on how do we identify and stop those pathogens from making that trip from animals to humans. Drs. Bell and Farnsworth are looking at things a little bit in the inverse. They are looking at humans, people who are testing positive for COVID-19, and asking the question, are people actually transmitting the virus to their pets? And so they're doing this work in partnership with University of Washington. I know that in the chat, if anyone is interested in participating in this study, there will be a link there where you can learn more. But let me stop and let Jessica and Raylyn tell us a little bit about what this project is, because I think it's actually really interesting.
Thanks, Phil. Dr. Bell and I are participating, as Phil said, in a joint project with the University of Washington. And that is what we're doing. We are looking at COVID positive households that have, and we're looking at their pets. So we're trying to see if the owners have transmitted the virus, the SARS-CoV-19, to the pets. And then we're going to look at maybe what that means as far as transmission.
To find this out, we're testing dogs and cats that reside in COVID-19 positive households for the SARS-CoV-19 virus. Our samples include a small blood sample, oral, pharyngeal swabs, and a nasal swab, and also a rectal swab. We're recruiting any household that has had COVID-19 positive person and has an indoor or outdoor dog or cat. In Seattle, our study partners are also looking at hamsters and ferrets. Each participant needs to complete a 10 to 15 minute survey at our about the household and their animals and how they interact. We can sample your animal either at our WSU Veterinary Teaching Hospital or in your home. The animals are handling sampling actually very well. The sampling does not require as invasive swab as in the human side.
And so far, we've actually sampled 51 animals in 31 different households. Our goal is to have 100 households, so we have a bit to go. To date, all the animals that we've tested have had negative PCR tests for SARS-CoV-19, the virus. But the antibody tests, we are currently validating the process, but they're showing some interesting results, which we hope to be able to report soon. What we haven't had is any positive tests, but if we do get a positive PCR test for the presence of the virus, what we would do is advise the owner to keep the animals quarantined from other animals, since studies have shown that there is some species to species transmission of the disease, but there is no study that is indicating any companion animal to human transfer yet.
Finally, we did want to do a little plug for our research study that if you are someone that is COVID positive or know someone that is, please go to our website and sign up for the study for your cat or dog and help us with this important research. We've put that link in the chat for you.
Great, thank you, Jessica. I'm actually looking at the, I have the YouTube chat open, and someone is asking if this study is only open to Washington residents, or could residents of Moscow, Idaho participate?
We just did one in Moscow yesterday, so absolutely, anywhere in this area, and we can go to your home, or we do have had a few people bring their pets into the veterinary teaching hospital.
Great, thank you. And again, that link is in the chat for YouTube if you'd like to learn more. I appreciate that. And, it seems to me that this is particularly important as we've seen this question about transmission from animals to humans and vice versa, as we've seen what has been transpiring in Denmark with mink there, and the concern that they may need to cull the entire population of minks in that country because there's a fear of whether or not there could be transmission. And so obviously I think that situation is ongoing, and as I think as late as today there have been new developments, but this idea of zoonotic diseases is really critical. And as I mentioned, it is something that the College of Veterinary Medicine has been focusing on for a number of years. And I think that we're fortunate to have that level of expertise that can help us look at some of these questions. I'm going to, speaking of our colleagues in the College of Veterinary Medicine, I'd like to turn to Dr. Anthony Nicola. Anthony has been working for quite a long time looking at how viruses are actually able to invade a cell and ultimately infect a cell. And obviously that has great interest with regard to the COVID-19 virus. If we are able to understand that process, we may be able to come up with interventions that would prevent the virus from being able to enter the cell. So Dr. Nicola, it looks like you've got your slides up. I'll let you take it away.
Great, thanks, Phil. It's a pleasure to be here. So I'm a virologist in the Department of Veterinary Microbiology and Pathology, and I've spent my entire career trying to understand how viruses infect cells. So specifically how viruses enter cells, the very first step in the infectious process. So moved the research laboratory here to Pullman in 2011, and we've been working on virus entry. So I always like to start by thanking the members of my laboratory. I'm very fortunate to work with a very talented group of scientists. So these are the good folks that actually do all the work. So what is virus entry and why is it important? So when you think about virus infecting a human or an animal, if you zoom in and think about it in simple terms, so you have a virus infecting one cell, so that very first cell. And if we're talking about the novel coronavirus, this could be a lung cell, for example. So the virus approaches the cell, and through a very complex, sophisticated series of processes, the virus succeeds in entering the cell. And so this is a multi-step process. It's very complicated, and we're very interested in the nitty-gritty details of every step here. But what I'd like to mention is that this provides several opportunities to interfere with the virus and stop the virus in its tracks. So if we understand how the virus enters the cells, this can lead to new ways to stop infection. And this includes interventions such as antiviral drugs for treatment and vaccines for prevention. So our laboratory has studied many viruses over the years. Our specialty has been herpes viruses, including the human herpes simplex virus, which causes cold sores and sexually transmitted infections. And we're at the vet school, so we're interested in veterinary herpes viruses that infect cattle and pigs as well. And we've recently turned our attention to coronaviruses, SARS-CoV-2 specifically. So this is a diagram of the virus. So SARS-CoV-2 is the name of the virus that causes the COVID-19 disease. And of great importance is this spike protein shown here in red. It's present on the surface of the virus, and it is a key component for how the virus infects, how the virus enters that very first cell. So this provides a place where we can intervene. And so when you're talking about antiviral drugs and vaccines, many times it is this spike protein that is interfered. And we have spent a lot of time understanding the spike proteins of many different viruses. So many viruses have their own version of the spike protein. And so we've learned a lot about the herpes spike proteins. And so what we're doing is we are applying our knowledge of the herpes spike to understand how the SARS-CoV-2 spike works. So this spike has a very interesting feature in that it changes shape, causing entry of the virus. So I have a diagram here, zoomed in. This is the spike on the surface of the virus. The virus is approaching a cell here, and the spike actually undergoes a change in its shape, and it actually reaches out and grabs the target cell and brings it in close so it can enter, so it can invade the cell. And you can imagine that this is a critical moment in infection, that if we're able to interfere, this would be a really good thing. So we're interested in, for example, a drug that might bind to the spike protein and prevent this change in its shape. So that if you prevent this shape change, you're preventing virus entry into that first cell, then you're preventing disease and infection in the individual, and importantly, ultimately, you're preventing spread to another person. So preventing this shape change is a new idea, a new antiviral approach to perhaps treat SARS-CoV-2 and other viral infections, such as the herpes viral infections. So what's next for us? So we're currently in the laboratory establishing experimental methods to understand how this coronavirus spike works. And we're seeking funding for this work. We have grant applications out to the National Institutes of Health and the National Science Foundation for our research on SARS-CoV-2 entry. So thanks for the opportunity to share the work. We appreciate it.
Well, thank you. Thank you for doing the work, and thank you for explaining it in a way that I could understand it. That was very helpful. Very intriguing. I appreciate that. All right, what I'd like to do now is, we've talked about how we might have new therapies to prevent the spread. I'd like to talk to Jason Sampson and have Jason, if you could give us an update on where is Washington State University, particularly the Pullman campus. Where are we with regard to the spread? Is there any information you can share with us about the numbers? I know we had, as I mentioned earlier, in August, at the beginning of the semester, we saw a significant increase. My understanding is the numbers have been decreasing ever since, but I'd like you to fill us in if you could.
Thanks, Phil. I appreciate the introduction there. Yes, so we have been having a really good reduction in the number of cases in Whitman County, which has been a really big positive for us. We like to look at it as a 2-week total because that kind of gives us a better picture of what's currently happening versus trying to include those August, because those cases in August are not active right now and they're not really contributing to coronavirus in our current state right now. So if we look at WSU, we've had 79 cases over a 2-week period. And obviously we don't live on an island. So the county itself, not counting WSU, is at 158 over that same time period, which gives us 237 cases. And if you look at a lot of the metrics on the state and other counties, they like to put it in cases per 100,000. And if we do the quick math, and I carry the one, and hopefully I did it right, we're at about 441 cases per 100,000. So that's a really important number to look at. If we look at regionally, it's really important to look at that same time that we've had 237 cases. Asotin County, which is Clarkston, is 284. Latah County in Moscow primarily is 410. And the big one is Lewiston, Idaho. They had 803 cases over this 2-week period. So while we were doing really good and we should be very happy about the position we're in, it's important to think about our employees and things like that live in those areas, that they're actually seeing a pretty sharp rise. And that has resulted in some of the stuff from the governors of both Idaho and Washington as we come on the holidays, right? And so as Mary Jo and Kirk have both mentioned, and Colleen's testing plan, currently we've done 8,624 tests from Cougar Health Services, Range Health, and the National Guard. This last week has been the 3 biggest days probably that we'll see so far. We had about 400 tests on Monday. We followed it up with 500 tests on Tuesday. And based on the lines that I saw this morning, we're going to have a similar numbers today. The good news with that is we're getting a pretty good picture of what our percent positivity is in our WSU community. And this morning is the results we got from those Monday testings. And just after a kind of a quick look at them, we're only looking at about 20 cases in that 400. So that's around that 5% positivity or lower. And so that's a really good direction we're moving, because as a lot of you might remember last time I spoke, we were in the double digits, around 15%. So we're definitely moving in the correct direction. Obviously, some of that's a result of just more testing, but our case count also is trending in the correct direction. So all in all, we're looking good. Just like to reiterate what Kirk had mentioned earlier, a lot of the cases right now are not students. We're actually seeing it in our employees more than we're actually seeing it in the student population. And the reason is we're still seeing gatherings and that socializing outside of work. We're not seeing that transmission again in the workplace, primarily not seeing it in any of those interactions. It's happening kind of in our social interactions outside of that kind of controlled environment. And that's what we really like to ask people to wear their masks, distance when possible, and just be careful who is in your bubble or your cohort during these holidays. Obviously, Washington, there's a little bit more restrictions. So if you do meet up with those people you've been seeing all summer, make sure that's outdoors. More ventilation is better for that transmission.
Great. Thank you, Jason. And I know that one of the concerns, I think, and actually the president mentioned this, that we, as a reminder to everybody, WSU is doing contact tracing for all WSU-related cases. Jason has a team of about 24 staff who've been trained by our county public health officials to be official contact tracers. But one of the things that we've seen is that people aren't necessarily being completely forthcoming if they test positive with regard to their to the people they've interacted with. Can you talk a little bit about that, Jason?
Sure. I think a lot of people sometimes when you get a positive test, you feel like you had a gathering with family and friends and you want to protect them because you feel like you're giving that information to a health department that's going to restrict them. Maybe you had a gathering and you maybe had 12 people over and we're only supposed to have 12. So you think you're preventing yourself from possibly getting in trouble. Know that all the information you share with contact tracers is protected. It's not shared with others. As you see, I'm doing an overview, but we're not giving details about anybody or any place. It's kind of just gives us a picture of where those possible cases are. And we want to make sure that the people that were in close contact with the positive know they were in close contact so they can actually possibly at least slow that transmission, right? There's lots of cases, so there's a lot of potential sources, but maybe if we control each source, we're reducing the overall transmission within the community. Now, if you still don't want to share those names, even though you know it's protected, please reach out to them directly yourself and tell them they can reach out to us and we'll talk them through this scenario. So that is another way to do it. But please just talk to the contact tracers. We're not trying to get anybody in trouble. It's really truly about transmission, and we do not share that information, any specific information with anybody. So we have seen a lot of cooperation within the community. We're really talking about just a few people that don't want to share something about gatherings or things like that. But no, it's truly in the best interest of our community and region.
Definitely. Thank you. Jason, another question. We had a question that someone had submitted online a couple days ago, and they were wondering if there's been any fatalities related to COVID-19 within the WSU community. Can you address that?
Sure. As everybody probably knows right now, unfortunately, we've had some fatalities in Whitman County. I don't want to diminish the fact that people have died because it is very tragic, but none of these have been associated with WSU. They're all within the community. Obviously, it's known that there was a spread, an outbreak in a long-term health care where some of those were associated. There's some other ones out there, but it's not associated with WSU, but we should still be conscientious that these are tragedies for a lot of people that were associated with those fatalities.
Yeah, I agree. Thanks, Jason. President Schultz, we're getting close to the top of the hour. Any last remarks from you before we are done for this session? We'll have, as I said, another one at 5 o'clock.
Well, thank you, Phil. And thank you to my colleagues here who've talked about some of the exciting research and scholarly work that they're doing, as well as just our continued leadership team working on managing the COVID-19 response in our community. I think, Phil, if anything, I want to just end on a little bit of the same note that I began with. 3 things: wear a mask, wash your hands, watch your distance, and be safe, Cougs. Thank you. Appreciate the opportunity to visit with everybody today.
Well, Kirk, I'm going to echo that as well. I know, as Mary Jo mentioned, I think we're all experiencing COVID fatigue, but now is not the time for us to let down our guard. We really do need to be more vigilant than ever. Unfortunately, across the country, we're seeing dramatic increases in the number of infections, and that is a really chilling statistic. We all have to be really conscious of the fact that there are things that we can do ourselves to keep ourselves healthy and to keep our loved ones healthy. And we've got to do one final big push, hopefully, before we can get the handle on this. But now is not the time for us to let up, and particularly as we enter this period of time where traditionally we get together with family members, with friends. This is not the season. This is not the year for us to be getting together, and it's painful, and it's tempting to say, well, I can make an exception for myself, but I do just sincerely ask that we all be vigilant, do the right thing so that we can all get together with our friends and family next season. So with that, as I mentioned, we do have another town hall scheduled this evening at 5 p.m. And it is aimed, as I mentioned before, at primarily students and their family members. So if you are a student or a loved one of a student and you're interested in learning more about what the spring semester is going to look like, I strongly encourage you to tune in. Again, you can go to the same place that you went to get this particular YouTube feed. That's experience.wsu.edu. So again, tonight at 5 p.m. Also, our 14th system-wide COVID-19 town hall is scheduled for Wednesday, December 9th. That will be the last town hall of this semester. We are already planning our town hall schedule for next semester, and I'll just give as a preview. The President's Commission on the Status of Women specifically has requested that we do a town hall aimed at caregivers and talking about resources and programs that are available to caregivers. We've all heard about the challenges that family members are having trying to maintain their work life on Zoom, trying to help children with their schoolwork, many of whom are having to study remotely. It is a really, really difficult and challenging period of time. So we're hopefully going to be able to spend an entire hour addressing some of the issues and concerns with caregivers. So watch for that. That will happen after the first of the year, and that will be our first town hall topic in the spring semester. So with that, I want to thank all of our panelists. I appreciate you all spending time with us. Also, would like to thank the subject matter experts. I've been monitoring the chat feature in YouTube, and we continue to get a lot of good questions. And it looks like there's been quite a few of those questions being answered in real time. So thank you to our subject matter experts. Finally, I want to thank all of you for joining us. This is an opportunity for us to talk to a large number of people, to answer the questions that we've been receiving both online and in the chat. And so we know it takes time out of your day, but we really do appreciate you spending your time with us and giving us this chance to have a conversation. So enjoy the rest of your week. And as always, go Cougs.